One area that the interprofessional team in Robert's case functioned poorly is their interprofessional communication. Robert, who's the patient in this case, mentioned that his wife Linda felt like the middleman between the whole medical team, where A would refer to B, who would then refer to A, and so on.
Robert also felt that the clinicians weren't sharing information between themselves and expressed that he was sad that the information wasn't being shared among them. In the ongoing management of Robert, the interprofessional team should have visited Robert at the same time where Robert would be able to list his worries and problems.
With the information that they get from the joint appointment, the team could start having routine group meetings where they could discuss and evaluate the management for Robert and come up with a conclusion of their plan. They could then go to communicate with Robert with the same plan in mind so that it would make Robert feel like they have all been working together as a team, having the same goals, leading to better patient outcomes for Robert in the end.
One major issue in Robert's case is that the healthcare professional didn't clearly explain their roles. He's seeing multiple health professionals, including a prosthodontist and a speech pathologist. However, he is having trouble understanding who's responsible for what, which had led to confusion for both Robert and Linda.
Ways that the healthcare professionals could prevent this problem from occurring will be to clearly state their roles to Robert and Linda when requested or when necessary, as some professionals that Robert and Linda are seeing might sound similar in name. This creates confusion and hinders understanding. This could prevent the confusion patients might feel when seeing multiple health professionals and allow them to best understand and how to utilize their resources available to them.
As a result, Robert will be able to understand the purpose of each appointment and how his treatment connects. This builds trust between Robert and healthcare professionals and reduces anxiety that he may experience before receiving the treatment. Linda will also be reassured that Robert is receiving an appropriate treatment.
The use of medical jargon by Robert's health professionals complicates his understanding of his treatment and excludes Robert from his treatment plan. These communication barriers contribute to confusion, anxiety, and reduce Robert's adherence to his treatment plan, ultimately decreasing autonomy and confidence. As a result, Robert's wife Linda takes time off work to attend these appointments to interpret information. This could lead to financial strain, furthermore burdening the family.
Professionals should approach this by using plain terms and accessible language while regularly checking Robert's understanding. Visual aids and written summaries can further support comprehension and recall. Actively involving Robert in discussions and decision-makings can build his confidence, promoting greater independence and reducing reliance and pressure on Linda. Additionally, regular interprofessional meetings, sharing treatment plans will enhance consistent understanding across all services, supporting engagement to uphold client-centered care.
Improving communication and actively including Robert in his care will help restore autonomy, support treatment adherence, and reduce the need for Linda to attend appointments, reducing overall family pressure. This approach ensures care is patient-centered, promoting treatment understanding, and enabling Robert to fully participate in health decisions.